Hi friends, my name is Sumi and I'm one of OET past candidate in the last months. I would like to share with you some points regarding OET writing criteria. Actually, OET writing has five criterias. If you know these five criteria and if you study well, you will pass OET writing easily. Easily means no need to write more than 3, 4, 5 sessions. So first of all, we will deal about the first criteria, that is task fulfillment. You should fulfill the task requirement. You should know what the recipient need. Recipient may be a social worker, maybe a community worker, or maybe a doctor. So you should know what the doctor needs. He needs medical history. Social worker needs social history. A nurse needs the care that should be given in the place the patient will be discharged or referred, the place wherever it is. So this is about the task fulfillment, and the main important thing is the introduction part. Introduction part include main issue and the reason of the admission and the request. These three things should be included in the introduction part. And the next one will be prioritizing the important information. So what you will prioritize? You will prioritize social history in social nurse in social worker, and community history in the community worker, and medical history is in the for a doctor. So this is how you will these are the points you should consider when you write an exam regarding task fulfillment. Next one, understanding your case note. How you will understand? The case note is the question that is given in your examination. It is a sheet of a paper. There will be a history of the patient. There will be, in this history, there will be social history, medical history, and the discharge history, and the care given, and the medications given. Everything will be mentioned. So just take what you need. Just select the relevant case notes. Cut it off all irrelevant case notes. You can blankly cut. If it is irrelevant means cut it off. Because for a social worker, no need more medical history. Just cut it off. For which is a doctor, no need more social history. So cut social history. So this is the way how you interpret the case notes correctly. And the next one is the grammar part. This is the backbone of your this is the main backbone of your OET writing examination, as you should focus verb tenses correctly. As verb tenses means what? There will be simple present tense, simple past tense, then the present perfect tense. Try to avoid past perfect, because past perfect it is a complicated tense that shows the very far information. So mostly we are not using this past perfect tense. So this is the verb tenses, and you should write social history in simple present tense, and in the simple past tense, what are the things that happened in the patient admission time? What was the things? What was the care given? What was the investigations we done? This will be included in the simple past tense. Okay, so this is about the grammar. Then next one is the connection of the subject and the verb. Subject will be the patient always. You should write every sentence. Every sentence should be a subject. Subject mostly the patient. And next one is the prepositions. You should include all the prepositions correctly, like after, then. So please concentrate on prepositions. Next one is this one, singular and plural. This is very important. That is, if you write in what to say for example, a wedge pillow, comma, a toilet razor, and a crutcher have been provided for him. Are given for him, are. So don't write is given. This is a big mistake. So try to concentrate. If it is a singular, you should write singular. If it is plural, write it as plural. The next one is a and the. This is the articles. This is very important in OET writing exam. A should be written in front of anything that is mentioned. A known case of a patient, like that. If it is and means you should write in front of vowels. The means the leg, the hand, the head. You know what it is, right? So you should mention everything, particularly the specifically whatever is in your body. So you should write all these things. So this is about the grammar part. Next one is the appropriateness of your language. So what do you mean by appropriateness of your language? You should transform the case notes given in a shortcut forms. BP equal this, temperature equal this. So you should arrange these vital informations into a simple sentence. Don't write complex sentences. Try to avoid compound, but just one or two compound sentence is good, so that you will make sure the examiner that you know how to structure a compound sentence. The next one is structure overall the letter in a logical way. Don't write in misarranged way, like firstly you will arrange the wrong social history for a doctor, then the medical history. This is illogical way. So try to make it in a logical way. Try to write the letter like a story of a patient. Just think like that. It is a story of a patient. What about the connectors? Please avoid all the academic connectors, like additionally, furthermore, what else? In addition, these are IELTS academic connectors. Don't write IELTS academic connectors. This is forbidden in OET. You can use simple connectors like however, therefore, enough. This too is enough. And fanboys, you know fanboys, what is this connectors? For, and, nor, be is but, or, yet, so. This is you can use in your letters. You can arrange in your letters. The next one is you should maintain a formal tone. Say for example, don't write mom. You should write mother. Don't write dad. Should write father. And what else? Like that, you can understand the way we are using in a professional way. You should write in a formal tone. The salutations, Mr., Mrs., you should write properly. And the abbreviations appropriately, like ECG, electrocardiogram. Then next, what is another abbreviation? You can write fasting blood sugar. Don't write FBS. Please elaborate fasting blood sugar. So this is about the appropriateness of language. The next part is the letter format. This is the last but not the least, because this carries more marks. In this part, 22 lines is the standard standard amount of letters. 20 words will be included in 22 lines. Don't gap. There should not be any gap in the right and left side of the letter. You should be filled. When the examiner see your letter, the two sides of the letter should be filled. There should not be any gap. The next one, the letter format is there should be a pattern. There is a pattern for, so you should follow the pattern. Address, then the date, then the dear whomever it is, then the reference, then the introduction, the main body paragraph, supporting body paragraph, then the request, yours, whomever it is. This is the format. You should follow this format. Then commas, full stops, and commas and full stops we are mostly using. So say for example, don't put full stop after Mr. There is no full stop after Mr. Most of them making this mistake. There is no full stop in the address. So these are the main points that I would like to tell you. One more, you should maintain a space in between each paragraphs. So these are the main 5 criteria, that is appropriateness of language, grammar, letter presentation, understanding case notes, and the task fulfillment. Please try to study on this 5 criteria. You will pass in OET writing. That I am guarantee for you. Thank you so much for watching my video.